Hi, I'm Aaron Mates. I'm a board-certified orthopedic surgeon with foot and ankle fellowship, specialized training from the Andrews Institute. I also have a background in sports medicine as well as cartilage research with an MD with a research honors as well as graduate school. As an orthopedic surgeon, I try to do my best with treating my patients and following through with all their needs, not only the clinical needs, but medical needs, psychological needs. A lot of pathologies are difficult to cope with mentally, emotionally. There's many aspects to medicine, more than just the orthopedic manifestations. Routinely, I use techniques that are mainstream, level 1, peer-reviewed data. So we use these techniques that we know are time-tested and true to help the patient. So most of the different surgical procedures that I employ are going to use this qualified, retrospective, reviewed data. What drives me in my practice is not only my passion for patient care, but it's my passion for the patient's overall well-being, not only physically, emotionally, but monetarily as well. There's a lot of patients who are in the community who have fallen prey or victim to different scenarios where they're spending money on a lot of techniques that aren't necessarily proven in the literature. What I mean by that is anything that is approved by peer-reviewed literature, where there's been science, as well as tested results with trials, clinical trials approved by a university or the government or a local community setting, who shows these techniques work. And those are what we use as orthopedic surgeons to be sure that we have good outcomes for our patients. My practice goals are cost-effective, patient-centered practice, to break the cycle of pain, deformity, and to break the cycle of spending time and wasting money on pathology that's not being corrected. We try to get you back to feeling better as soon as possible and we guide you through the process. So first thing that we do is arrive at an accurate diagnosis, make sure that we move from that point on. So we won't begin any type of treatment until we know exactly what is going on, what the pathology is involving. And the way we do that is through a thorough evaluation, physical examination, history. These are the cornerstones of my practice to begin the treatment and diagnosis. And then at that point we go from all conservative measures first, and we exhaust all conservative measures before entertaining any type of surgical procedure. However, if it's indicated or needed, then we have a thorough discussion about the options as well as the risks and benefits of all procedures. In the advent that surgical procedure is necessary or warranted, we're sure to cover every basis as far as your want and needs through the whole procedure, as far as getting things approved through your insurance company, knowing the deductible and all the co-pays involved with the procedure, as well as the procedure itself. A lot of times what I utilize is a block where the anesthesiologist will provide a regional block, so there's virtually no pain during the procedure. We keep you very comfortable, and we walk you through the whole process before and after the procedure as far as pain control, different modalities, and things that you need to do after surgery to make sure you have a good outcome. I have the privilege to serve as one of the team doctors for the Toronto Blue Jays, in addition to the team physician for Mitchell High School. In addition, I'm a consultant for Wright Medical, which is a orthopedic implant device company, where we work on developing new products, techniques, as well as teaching physicians throughout the country on new devices and techniques in orthopedic surgery. The foot and ankle is a very complex structure. There's multiple joints involved, everywhere from the ankle to the midfoot to the forefoot. Many pathologies people come in with, very common pathologies, includes things such as bunions, hammer toes, midfoot arthritis, ankle arthritis. We begin with x-rays, physical examination, work through the process in different modalities. We begin with a complex structure of non-operative modalities, including shoe modification, activity modification, and we walk you through the process, and we go to the next level as needed to treat the pathology that you're dealing with. A lot of times in orthopedics we use different terms to explain different scenarios in treating patients. One of those is modalities, such as modalities of treatment, modalities of care. In treating patients with what we call modalities, what we're talking about is the comprehensive picture involved in the care of that patient. So it could be physical therapy, it could be at-home exercises, including diet, stretching, shoe modification, activity modification, All these things encompass the modalities involved in that episode or that injury or that pathology. So these things kind of all come together to unify the treatment protocol for that patient. I'm going to talk about plantar fasciitis. Very common that I see a lot in my clinic is plantar fasciitis. And this is a very difficult pathology to not only understand, to fully embrace, but to get through and heal from. This is a problem with the heel on the bottom of the foot. There's fascia that comes off that goes to the toes. And what the purpose of it is to give you an arch. So it helps assist in walking. What can happen is, of no fault of your own, people who are sedentary, people who are very active, they can get inflammation in this fascia, which can cause significant pain, significant deformity, inability to walk, and this is life-altering. It's very, very difficult pathology to deal with. A lot of the environments that we're in the 21st century, concrete, tile, hardwood, contribute. So right out of the box, we recommend anti-inflammatories, shoe modification, and stretching. And we go through all the different treatment protocols to get this thing well. But this is a very serious problem, and anyone who's had it knows how serious it can be. A lot of times it's a lifelong issue that waxes and wanes over time. Bunion disorder. I see a lot of bunion disorder. People ask about different kind of shoe wear, what they can do to help prevent it. A lot of times it's multifactorial, so there's genetic components, activity components, and shoe components. It depends on the etiology of your specific bunion and what's going on. But there's a lot of things we can do to slow the process over time and prevent surgery and prevent intervention. Sometimes if the pain is too much, we have to pursue surgical options, but we have a long, thorough discussion about what we're going to do as far as correcting the bunion, usually involving cutting a bone, sliding a bone over, correcting the soft tissue alignment to better restore the mechanics of the foot to allow for a balanced gait and appropriate heel-to-toe stride. What is a bunion? A bunion is where the tissue in the great toe of the foot begins to become lax or attenuating, meaning it stretches out. So it starts to go around a curve. This can be made worse by people who have flat feet and when their arch collapses. That's why we'll sometimes give you arch support to help. When the arch collapses, the bunion becomes worse, tissue stretches out, and you get a deformity which can cause a lot of pain in the forefoot, making shoe wear difficult, activity difficult, and walking difficult. This comes in tandem a lot of times with hammer toes that occur because of the bunion, and these can rub in the shoe and cause pain, making walking difficult as well. I see a lot of patients for foot and ankle sports injuries, including professional athletes, high school athletes, or just local community athletes. The weekend warrior, people who run marathons, have a whole litany of different pathologies that can happen in the foot and ankle. Most common is the ankle sprain. Everyone's had an ankle sprain at some point in your life. The problem is when you have them over and over, it can lead to ankle instability. There's an important ligament that keeps the ankle from rotating. And when you sprain your ankle multiple times, that ligament can become weak, attenuated, and it has what's called attrition, where it heals weaker and longer. Almost like a rubber band. Over time, it gets dry, cracks, and snaps. There's different pathologies associated with it, including ankle arthritis, instability, and we take you through the whole process of getting it to heal. A lot of times these do great with physical therapy and bracing. If not, we explore other options if we need to reconstruct the ligament down the road. Generally, in orthopedics, whenever we use words such as pathology, we're referring to an abnormal situation. It could be injury, it could be trauma, it could be a whole litany of different things where there's an abnormal situation occurring. Example I like to use with patients is you develop arthritis in your ankle. A lot of times the arthritis itself is caused by something else. So the example I use is the tires on a car wearing down where the alignment is off. The alignment is the problem leading to the worn out tires. In the ankle, this happens a lot, where the alignment of the ankle can be off from different pathology or injuries, leading to arthritis in the ankle joint. So in order to fix the arthritis, we need to correct the alignment. And there's different ways that we go about doing that depending on what happened. Just like in the hip, the knee, and the shoulder, you can get arthritis in the foot and ankle. It can be located in the ankle joint itself, in the midfoot, or in the toes. Sometimes people will come and say that they have issues with their big toe being stiff and tight and it hurts when they walk or wear different shoes. There are options for that. It's called stiff toe or hallux rigidus, hallux limitus, which can lead to arthritis in the big toe. There are a lot of conservative measures that we employ to treat this problem, but there is a newer technique surgically which has allowed for quicker recovery, short hospital stay, outpatient surgery, go home same day, and actually walk out of the operating room. Surgery typically takes 20 to 30 minutes, and it's called a Cartiva implant, which is a little bumper that goes inside the toe. And what this does, it affords the patient the ability to have the motion to offset that arthritis, and they actually do really well back into a regular shoe on average around 3 to 4 weeks. A lot of times I'll have patients come with arthritic conditions in the foot and ankle. A lot of times it's located in the ankle joint itself, different joints throughout the foot. Fortunately, with the foot, there's a lot of different options, non-surgical options that we employ and that we utilize prior to any type of surgical intervention. Sometimes patients are not a candidate or they've failed all these measures over time. A newer technique that I use in the ankle is the ankle replacement. Just like a knee or hip replacement, we salvage the joint and prevent a fusion in the ankle by doing a replacement. This allows you to keep the range of motion so you can walk, in addition to having pain-free loss of pain through this region from the arthritic changes. A lot of times there's different procedures that need to be done along with the ankle replacement, but it depends on your specific condition and specific pathology. In addition, I use a new modern technique where we take a CT scan, which makes a 3D model of your ankle. I use that as a guide to do the surgery, and we plan the whole surgery prior to actually going in and doing the procedure itself, which has better outcomes as well as better results with the patient with range of motion and healing. So we know the entire process before we even start the surgical planning. A lot of patients and the population in general are suffering from diabetes in our community, nationwide as well as in the world. In America, this is almost an epidemic, which is causing a lot of problems, most notably heart conditions, liver, kidney, as well as foot and ankle conditions. People have what's called neuropathy, which is where they have loss of sensation. That sensation is very important. It's protective. It prevents you from having injuries as well as wounds and deformities that can occur in the foot. Sometimes we roll our ankle, hurt our ankle, crossing the street, missing a curb, and this leads to significant injuries that the patient can't feel because they have the neuropathy. Ultimately, this can lead to breakdown, which can lead to different wounds, requiring multiple surgical procedures. My goal in my practice is not only to correct those deformities and fix those patients, but to help prevent this with community awareness, talking to primary care doctors, as well as teaching patients to be aware of their situation, that not being able to feel is not necessarily a good thing, that they need to have tight surveillance, looking at their feet daily. If any of you have any kind of these issues, you need to have a close watch with your primary care orthopedic surgeon to make sure that there's no pathology or deep problems brewing underneath the surface that we can't identify or see yet. A key portion of my practice is athletic performance and injury prevention. As a consultant and team doctor for the Toronto Blue Jays, I work with them closely to help develop protocols to prevent injuries in athletes on the professional, the minor league level, as well as the high school level, with some local teams here at Mitchell High School in Trinity. I bring all those techniques to my practice for my population in general to help prevent injury. The key is to prevent the injury from occurring and to optimize the patient to allow them to successfully progress with their activities that they enjoy, whether it's biking, playing golf, kayaking, or just playing cards or gardening. All of these different activities can lead to injuries if not properly optimized and conditioned and strengthened for those scenarios. We have a lot of different techniques and modalities that we talk about to help you, not only your lower extremities, but also the hip and the knee and the shoulder, to prevent injuries and to keep you going and sustaining those activities that you enjoy. Thank you for entrusting us with your care today. I look forward to meeting you and doing everything we can to help you realize your goals in life with respect to not only your musculoskeletal ailments or problems, but just overall function in general, to get back to living the life that you desire.